So, what could motion sickness and major surgery possibly have in common? I know, it sounds like the start of a weird riddle, right? Well, the answer is actually a really fascinating class of drugs that are all about one thing: blocking signals inside our bodies.
So today we're going to take a tour of these powerful signal blockers. The official name for them is cholinergic antagonists. We're going to dive into how they do what they do, where they work in the body, and why they're just so incredibly critical in medicine today. Ready? Let's jump in.
So, what exactly is a cholinergic antagonist? Well, the easiest way to think about it is this. Imagine your body's nerve signals are like a bunch of keys, and they're all trying to open specific locks or receptors. The key is a neurotransmitter called acetylcholine. When it fits into its lock, boom, an action happens. A muscle contracts, a gland produces saliva. You get the idea. Now, these drugs, they're basically like shoving a piece of gum into that lock. The key can't get in, so the action is blocked. It's a simple idea, but wow, is it powerful. All right, here's our game plan for this explainer. First, we'll cover the why. Why we'd even want to block signals at all. Then, we'll meet the big players, the systemic problem solvers. After that, we'll look at the specialists for the lungs and eyes, then the drugs that calm down nerves and the bladder. We'll finish up with the real heavy hitters used in surgery, and then, of course, wrap it all up with the key takeaways. Okay, first up, blocking the body's signals. So why do we do this? Well, by getting in the way of that acetylcholine signal, we can actually fix a whole host of medical issues. We're talking everything from a heart rate that's dangerously slow to an overactive bladder. The core idea here is targeted interruption. So let's meet the first two big names on our list, atropine and scopolamine. You can think of these as the Swiss Army knives of this group. They're the systemic problem solvers, meaning they have really broad effects all over the body. And atropine, wow, this one is a real jack of all trades, especially in the ER. It can literally save a life by speeding up a slow heart or acting as an antidote for some really nasty poisonings. Before surgery, it's used to dry up secretions to make sure the airway stays clear. It can even dilate pupils for an eye exam and calm down spasms in your gut. I mean, that is an absolutely incredible range for just one drug.
Scopolamine, on the other hand, is much more of a specialist. You've probably even used it without knowing. If you've ever stuck one of those little patches behind your ear for a cruise or a winding road trip, that was scopolamine. It is fantastic for preventing motion sickness, and it's also a go-to for handling that queasy feeling after surgery. Okay, so we've seen the drugs that work pretty much everywhere. Now let's narrow our focus a bit. We're moving on to the precision blockers. These are agents that are designed to hit very specific targets, starting with the lungs and the eyes. All right, when we talk about the lungs, it's all about timing. You've got two main types here. First, there's ipratropium. It's what's called a SAMA, a short-acting muscarinic antagonist. Think of it as the rescuer. It's for immediate relief during an asthma or COPD flare-up. Then you've got cheotropium, which is a LAMA, a long-acting one. This is the preventer. You take it every day to keep those attacks from even happening. See the difference? Rescue versus maintenance? And the list for COPD defenders doesn't end there. You'll also see drugs like glycopyrrolate and eclidinium used. They also help keep the airways open, giving doctors a really robust toolkit for long-term management. Okay, now let's shift from the lungs to the eyes. The same exact principle of blocking signals is at play here. Drugs like tropicyle and cyclopentolate come in eye drop form, and their whole job is to dilate your pupil, make it bigger. Why? So your eye doctor can get a really good, clear look at the back of your eye during an exam. All right, our next stop is all about calming things down. This whole category of drugs has one mission: to rein in systems that are just, well, a little too active. We're talking about taming unwanted nerve signals in the brain and telling overactive muscles in the bladder to just relax. This is a great example of how you can have two different drugs aiming for the exact same goal. Both benztropine and trihexyphenidyl are used to treat Parkinson's disease and also some movement-related side effects from other medications. They basically work by helping to restore a very delicate chemical balance inside the brain. And speaking of overactive, check this out. We have a whole family of drugs just for dealing with overactive bladder. You know, that condition where the bladder muscle just contracts way too often. By blocking the signals that are screaming, squeeze, 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 these drugs can provide a ton of relief. But even within this family, doctors have to be smart about their choices. Take trospium. This one is often the go-to for elderly patients or those with dementia.
And the reason is super important. It's designed to be less likely to cross into the brain. That means a lower risk of causing side effects like confusion, which is obviously a huge deal for that group of patients. And here's another great example of that precision targeting we've been talking about. Darafenacin is really special because it's selective. It specifically goes after the M3 receptor, which is the main lock you find on the bladder muscle. Being so targeted means it's incredibly good at its job, and it's less likely to cause unwanted side effects somewhere else in the body. Okay, we've saved the most powerful group for last. We're now talking about the neuromuscular blockers. These are the drugs that create a temporary, completely controlled paralysis, and they are an absolutely essential tool for any modern surgery. So how do you do that? Well, there are basically two different paths to paralysis. On one hand, you have the non-depolarizing agents. These are our classic gum-in-the-lock guys. They just physically block acetylcholine from getting to the muscle. Simple. On the other hand, you have depolarizing agents, and their approach is way more dramatic. They actually overstimulate the receptor, causing a twitch, and then the receptor just gets exhausted and shuts down completely, leading to paralysis. The non-depolarizing agents, these are the real workhorses of the operating room. You'll hear names like rocuronium and vecuronium all the time. They're used to relax the patient's muscles, which makes the surgeon's job much easier and safer. They're also crucial for intubation. That's placing a breathing tube, and for keeping patients on ventilators in the ICU. Now, on the depolarizing side of things, there's really only one major player, succinylcholine. Its claim to fame? It works fast, incredibly fast, and it wears off quickly too. That makes it the #1 choice for emergency intubations where every single second counts. It's also used in electroconvulsive therapy to prevent muscle contractions during the procedure. We have to talk about one more agent here, and it's a bit of an outlier, nicotine. Now, yes, it does block certain nerve signals, but at high doses, it does so in a totally uncontrolled and dangerous way. So let's be crystal clear. Unlike everything else we've discussed, nicotine has absolutely no therapeutic use. At these levels, it's just a poison. Okay, deep breath. Let's zoom out and look at the big picture. We've covered a lot of ground on our tour of the body's signal blockers. So let's just recap the big ideas, right? We have the systemic agents like atropine that are broad, life-saving heroes. We have the targeted drugs that are like snipers, solving specific problems in the lungs, eyes, and bladder. We have the anti-Parkinsonian drugs that work to calm down unwanted nerve signals. And finally, the powerful neuromuscular blockers that are absolutely vital for surgery. The common thread through all of them? Control. It's all about that targeted interruption. You know, this ability to selectively turn off signals in our body is really one of the cornerstones of modern medicine. It's just amazing how much we can do by understanding our own nervous system. And that kind of leaves you with a really cool question to think about, doesn't it? As our understanding gets even more precise and our tools get even sharper, what problems will the next generation of these signal blockers be able to solve?